Our body continues to develop after being born.
The baby grows up into a child, and the child enters puberty to become an adolescent. Puberty normally starts between the age of 10 to 12 in girls, and between 12 and 14 in boys, and lasts 2 to 5 years. During puberty, there are several changes to the body. The reproductive organs mature. The testes in the boy begin to produce sperms, and the ovaries in girls begin to release mature eggs. At puberty, the reproductive organs also produce sex hormones. These hormones cause many physical changes in the body. During puberty, the boys grow rapidly. His height can increase rapidly in a short time. The body also becomes more muscular. Hair grows on the face, above the lips and around the chin. Hair also grows on the body, especially under the armpits and around the reproductive organs. The voice of the boy also breaks as it becomes deeper. As a lot of growth is done during this period, the body needs more proteins and nutrients, and the boy's appetite will increase. The reproductive organs grow larger in size, and they are now capable of producing sperms. Often, the sperms are released from the penis at night. This is called nocturnal emission. Nocturnal means at night. Nocturnal emission may sometimes happen during dreams. This is normal and harmless, and happens with most boys. During puberty, a girl grows taller rapidly. The hips become rounder and wider. Hair also grows under the arms and around the reproductive organs. The breasts grow larger and menstruation begins. As mentioned earlier, we may not develop at the same age or at the same pace. For girls, puberty starts at around 10 to 12 years old and may last 2 to 5 years. So there is nothing to worry about if your body develops earlier or slower than your friends. At birth, a girl has many unripe eggs in her ovaries.
When the egg is ripe, it will be released from the ovary to the oviduct.
A woman has a menstrual cycle, which is the female reproductive cycle that makes eggs available for fertilization. In the first phase of the menstrual cycle, the lining of the uterus builds up and holds more blood to receive a fertilized egg. At mid-cycle, when the egg is ready, the ovary releases the egg. This stage is called ovulation and is the optimum time for fertilization to take place.
The egg enters the oviduct on its way to uterus.
In the last phase of the menstrual cycle, one or two things happen. If the egg is fertilized, it continues to move into the uterus, attaches itself to the lining, and pregnancy begins. If the egg is not fertilized, it will die. Therefore, the thick lining in the uterus is not needed. The egg, together with blood and the uterus lining, comes out of the vagina. The removal is called menstruation, or period, and can last from 3 to 7 days, depending on the individual. The length of a menstrual cycle is the number of days from the first day of one menstruation to the first day of the next menstruation. The length of the menstrual cycle also varies between 23 to 40 days, depending on the individual, but the average menstrual cycle is about 28 days.